Welcome to St. Louis on the Air. I'm Don Marsh. We change directions now as we talk about a local company that's providing an important service for underserved, low-income, and chronically ill people. It's a mail-order pharmacy based in Maryland Heights. Its name is RX Outreach, and with me in studio is its president, Daryl Munden. Daryl, thanks so much for being with us.
Well, thank you for having me. Thank you.
You know, the first thing that came to my mind when I heard about your company was, my God, they're taking on Express Scripts. And then you dig a little deeper into the story and come to find out that Express Scripts has really played a big role in your company.
They actually have. Yeah. So our genesis, or the beginning for us, is actually through Express Scripts. And this program actually has a fairly long history beyond just where we separated out as a separate organization in 2010. It was actually in 2004 there were employees within Express Scripts that said, can't we do something of good to be able to help those that are out there in need? So that was the beginning of RX Outreach. And it was in a latter part of 2009 that my predecessor came up with the idea of taking the program and spinning it off as a separate nonprofit company.
Go ahead.
And it was amazing as to how quickly that thought in that white paper that was presented to Express Scripts ended up as real action in separating this program from the company.
I think it was Henry Kaiser who said, find a need and fill it. And he did pretty well, and that's exactly what you're doing. Talk a little bit about the need. We discussed this off the air, but there's a tremendous need to serve these people.
Absolutely. Now, you can go to the big numbers from a national perspective and see, we, prior to the Affordable Care Act, 47 million Americans were uninsured or underinsured, and, then after that there was 23 million. But just in your day-to-day life, there are friends, there are neighbors, there are church members, and you may not know it, but many are impacted by the affordability or the lack thereof of a medication. And so our mission as an organization is to provide affordable medication to people in need. And so that need is great, and what we understand as well is that there's an interconnectedness that exists, and I call it the equation of life. Someone who has medication, lower income, and we serve people that are up to 300% of the federal poverty level, so a single person, $36,000, a family of four, $72,000. And then some person has medication needs, but they also have to pay for gas. They have to pay for the utilities. And they're trying to make this whole puzzle work. And so for us, being able to solve in that particular area is very important. And it does allow them to make that equation work a little bit better.
And we're talking about people in this category who are of all races, needless to say. But I bring that up because we did a program here yesterday on the inequity in income, particularly involving black versus white Americans. In this region, they make about half of what a white worker makes. These are the people you've got to get to.
Absolutely. These people, and there's a growing need that takes place in rural communities. And that's because the services that were there may no longer be there, that being hospitals that are being shut down, that being independent pharmacies that may no longer be there. And so for us, we're an ideal solution because we're a mail-order pharmacy and we can get to those locations that people can't easily get to.
Yeah, we can't forget Medicaid in the state of Missouri either, because that's causing a lot of those hospitals to close and causing hurt for a lot of people. How specifically, Daryl, does it work?
So it's pretty easy, and we want to make it as user-friendly and easy as possible. So an individual gets a prescription and from their physician or their doctor, the clinic. And many of the people that utilize our program actually go to free and charitable clinics all across the United States and here in Missouri. They get that prescription. They can either have it e-prescribed over to us or they can be mailed in to us. And then we will fill the medication. And so we have a 31,000 square foot operation, and we do everything from start to finish. Fill that medication, ship it out to them. And there's a one-page application. But they can fulfill that by either going online themselves and completing that, calling our call center and speaking to one of our advocates. And once that's done, they'll be accepted into the program, and then that whole process kicks off with a prescription.
When you talk about low-cost medications, what are we talking about? What's the difference between what you're offering and what's otherwise available out there?
Sure. There are many medications on our program that you can get a 6-month supply for $20. Mm-hmm. And these are chronic generic medications, and they're the same medications that you would go to a major retail establishment and also purchase. The difference for us is that we're a not-for-profit. We're mission-driven. And for a for-profit organization, obviously they have shareholders to answer to, but for us, we're answering to those patients and trying to make a difference in their lives.
Where do you get the pharmaceuticals?
So we're part of a group purchasing organization, and so we're in partner with others in aggregating our spend. And so those same manufacturers supplying just about any other retail establishment are the same ones that we're using.
Are all of the medications that you're talking about generic? You mentioned generic, but are they all?
No, they're not. We have a small slice of our medications that are brand. We have some great partnerships with some pharmaceutical manufacturers that understand that the cost of medication where it is a struggle for many. And so we run several patient assistance programs for those manufacturers to make medications affordable, and that's where some of the brand gets inserted into our process.
You mentioned the pharmaceutical industry working with you. The pharmaceutical industry often gets a bad rap because of the exorbitant prices in so many cases. Interesting that they're working with you.
Yeah, they do, and so there's a good side to the organizations as well. Many of them do have patient assistance programs for the brand medications. There are copay assistance programs that are out there as well. All of those things work together to make medication affordable. And yes, there are some that are partnering with us to help us further our mission.
Well, the name of the company is RX Outreach. We have to take a break. We'll do that now and come back with Daryl Munden, who is the president of that organization. As you have been hearing, it is a company that is providing low-cost medications to the people who are most in need, who can least afford medications under most circumstances. Back in a moment to continue. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU. And welcome back as we continue our conversation on RX Outreach, the St. Louis mail-order pharmacy. Daryl, how are you working with Medicare and Medicaid, or do you?
Well, we don't work directly with them per se. If individuals are on Medicare, and this is where we find that with Medicare patients where we provide our services. Many times they get into the donut hole probably around the third quarter of the year. Mm-hmm. And at that point, when they're in that donut hole, they have the responsibility for bearing the full burden of those prescription medications. And so many of them turn to us at that time because we are a very affordable option and get medications from us until either the year completes or they come out of that donut hole. Mm-hmm.
The donut hole being that process of, what is it? It's the D part of the whole process whereby you can get prescription drugs.
Right, and you have to have approximately $2,900 spend. Then you get into that gap, and in order to get out of that gap, you have to have about a total of $5,000 to spend.
It's complicated.
It is.
It is a very complicated process. People complain about it all the time. What about Obamacare?
You know, and we take the position with Obamacare. We were impacted by Obamacare in the fact that Medicaid expansion, there were patients that we would ordinarily serve that were now part of Medicaid. And that was great because they had the services that they needed, the medications and access and all the like. It did have an impact where we were no longer serving those patients, and but that's the good. And so we have grown our organization still because there's still so much need out there beyond even those that were benefited by the Obamacare.
I have some numbers here that I think are pretty interesting. Mm-hmm. Your company claims that it's saved some $320 million, I think, for folks. Is that an accurate number?
That's actually a little understated. I'll give you It's about $572 million since inception.
That's obviously a lot of money. You're serving more than 70,000 people in all 50 states.
That is correct.
Right. One question that came to my mind as I was looking over some information on this is, I suppose that among the medications that you would distribute, opioids would be a part of that. And if so, that's a problem these days. Are there any controls that you have to put in because of that?
Well, we don't actually dispense any opioids, any Schedule II medications. That's where they fall. And we do that. We don't do that because the population that we're serving and the potential for diversion and the like. We do have controlled medications, though, for other reasons. And we do have very strict controls, a separate cage and processing. So there are very stringent measures, even for those that are not up to the level of opioids.
Are you getting a lot of people applying to become a part of this process online? I notice that's one of 3 ways they can do it.
Yes, we are. We have continually, and as we're averaging about almost 900, close to 1,000 patients a week that apply to our program.
That's an impressive number.
Yeah.
How do others in the pharmaceutical field feel about you?
You know, they feel good that we're here. As a matter of fact, in working with manufacturers, for example, or working with, and let's kind of spur off and talk about the other advocacy agencies and medical clinics and the like, they are happy that there is a resource available in this space. And they're happy, for example, on a pharmaceutical manufacturer perspective, to be able to say, if I can't help you, I can refer you to this organization that can help you. So we're that referral option that people will point to help people when they're in their time of need.
So all of your funding then comes from third-party donors, if you will?
As a matter of fact, we're 99.9% self-funded. And that comes from the nominal fees, like I mentioned earlier, that we charge our patients for those medications. Last year, we shipped 353,000 prescriptions all across the United States, 90-day and 180-day prescriptions. And those fees for those medications are what largely allows us to operate our entire operation over the course of the year.
What about transfer of prescriptions?
Yes, we do accept transfers, and we will have material and literature on our website, and our representatives also have information, and they can take that information to help facilitate the transfer of prescriptions.
We will put a link to your website on our website at stlpublicradio.org so folks can reach you that way. So much of what you're talking about can happen online and does happen online. One of the things I think has to be mentioned is there are a lot of people out there who are not online savvy and may not have the wherewithal to own computers.
Right.
Just give me a little more specifics on the other ways that they can get at you.
So we have a call center with about 25 individuals, and we take over 10,000 calls on a weekly basis.
In Maryland Heights? All of this in Maryland Heights?
All of this in Maryland Heights.
Uh-huh.
And so that's the other way that someone can get to us is to actually call RX Outreach, and that's 1-888-RXO-1234. And by calling that number, someone will take their call. And typically the calls are about, well, do you carry this medication? Can I enroll? And all of those things, because we do serve a more skewed senior population who prefer the call, we can accommodate that as well. And so then by working through other advocacy agencies like 211s, area agencies on aging and the like, they can also get information and pursue getting into our program.
My understanding is, and again, my numbers may be a little dated by now, but that you have about some 600 different medications that you're working with. Does that sound right? Is that a number that is added to? And what is that process if, in fact, it works that way?
Sure it is. So to give you a kind of a measure, when we spun off back in 2010, we probably had 300 different drug strengths of medication. We currently have over 800 different drug strengths of medication on our formulary. And what we do is we analyze what the needs are. And as medications also come off patent, we will look to add those and defray or reduce the cost so that if someone needs that brand medication or that particular medication that just came off patent, we will try to get it, and we will price it well below where the market is so that it's affordable for our patients and it's true to our mission.
What about quality control? A lot of the medications in this country are made abroad, and there have been some cases in recent years in which they have been criticized and suspect even. What's your quality control like?
Well, see, and that's the good thing for us is that part of our GPO, that's their responsibility as well in contracting with providers that have and satisfy the quality measures. And so there will be where if there is an issue that they will stop. And there are also FDA inspections that take place at these facilities. All of those things are in place to ensure a supply chain that has integrity and quality built into it.
You have another operation, which I just learned about during our last break, and that is a program dealing with ex-offenders. Is it a national program also?
That is not yet a national program, but that is a Missouri-specific program, and that's where, in partnership with the Department of Corrections, Corizon, and RX Outreach, when an ex-offender leaves one of the correctional facilities here in Missouri, they will obtain a 30-day supply. Through fundraising, we actually provide another 60 days of medications for a total of 90. The 90-day supply is important because that's typically how much time it takes for someone making that transition to find a clinical home and then begin seeing and receiving service.
What was going on that caused you to look in this direction?
Well, there was a gap. And when you talk to those that really work in this area, I think there was a quote that I remember that this has been a problem for the 30 years that I've been doing this. And so in order to be able to help people, because what we've also found out is that many of those ex-offenders, about 50% that we've served thus far, have mental health conditions. So this is a safety, community safety, plus ensuring that an individual is able to have the medications to stay healthy. And that's what prompted us to look at this.
How long has that been going on?
This has been going on since 2016, around April of 2016.
Any idea how many people you've worked with on this?
Probably about 2,000, and about 6,000 prescriptions have been provided through this program to them.
We talked a little bit prior to going on the air about, and also shortly a little bit on the air, about the importance of health care in the populations that we're talking about. We've done many programs on that. From your vantage point and your perspective, what are some of the things that are impacted by people who don't have access to the proper health care, i.e. medications?
Yeah, I think there's an interconnectedness here that, for example, if an employer has an employee that doesn't show up from work, well, what could that be? Could it be that they didn't have the access to the medications that they need in order to be a viable employee that can come to work? And I know personally for us as an organization, we've recently made a change. We provide a free medication program for our employees, full-time and part-time. Mm-hmm. And because we understand the need to be healthy, not only at work, but even in your own home life and for your family, for your community. There are the burden far reaches past just that family and into the community, because we all are impacted when the populations of people lower income as well, because they're going to show up in an emergency room. And if they do, does that show up in your premium cost? And so there's that. We need to be mindful of being able to help them, not only because it's the right thing to do, because it will show up somewhere.
One of the places it shows up, and again, we've talked about this on this program, I know you're aware of the For the Sake of All report, which showed that zip codes that can be just a couple of miles apart can show a disparity in life expectancy of up to 18 years, and that's all related to health care.
Sure, it is. Life expectancy shortened by a significant degree just because I live here versus there is not where we want to be.
Why wouldn't you have remained a part Express Scripts? I mean, it's there, it's a giant, and it has all the tools that you would have to have.
It would, and it really was a question about how inclined would those that we work with be to support us or give us more support outside of the for-profit environment versus being a not-for-profit. And so we thought, and it has proven to be the case, that by spinning off and becoming a nonprofit organization, we can rally more support for our cause. And then that allows us to expand and provide greater services.
We've been hearing recently about plans by some of the people at the top of the economic pyramid in this country to establish their own healthcare system. I'm thinking of Warren Buffett and some of the other people that he's associated with. What's your take on that, and would that sort of thing impact you?
I think that so if you're talking about that and see, that's a conversation that we sometimes within our organization say is above the line. We draw a line. There's some people that will not be impacted by these conversations because they're going to do that for the people that may be in the workforce, that may have the extension of benefits, health care and the like, and then making that more affordable to them. So there could be some cascading effect from that. But the people that we are also serving are those that are working 2 part-time jobs. They're catching the bus, or it's a traditional working family that has a burdened amount of medications. And so I think it's admirable. I think that there could be some benefit. There's a lot to be figured out, but I don't think that it's going to directly impact that population that we're targeting.
And yet it could have significant impact on the healthcare operation in the country and basically kind of shove government aside, it looks like to me.
It could. And, so if it creates competition that can reduce cost and it improves the service, all for it. And if we can get some tangible benefit that we can apply to the people that we're serving, we'll be standing right there.
Where do you go from here?
We talk about the 70,000 patients that we serve. We know that there are many more Americans that are out there that need our services. So our goal is to find the right way to get to them, and then to also create partnerships that allow us to further reduce the cost of medications. For even though we think that we have a good tool, a good operation, a good formulary, we want to be able to do more. And so where do we go? We go from state to state with our Healthy Transitions program. We look for more and more partnerships to be able to further the services that we provide and the impact that we have.
We only have a few seconds left. Why Maryland Heights?
The operation was there. It's a great place for us, and it was all $7 million of assets were there. And that's where we are, and that's where we remain.
Well, you've got to be very proud about how much has been accomplished in a very short period of time and the number of people across the entire country that you've helped.
We are, and I'm going to use the word we because we have a great team dedicated to this mission and look to execute it every day.
Well, I want to thank you so much, Darrell Munden, for being with us. It's fascinating to hear what you're doing out there, and it's always good to hear when you have successful operations working in our own neighborhood. Thank you so much. The name of the company is RX Outreach. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.